What is obstructive sleep apnea and how prevalent is it in the UK?
The cause of sleep apnea I think we know quite a lot about now, and it's quite clear that for most people with sleep apnea, the problem is that as they fall asleep, the tone, the strength in the upper airway gradually means that the upper airway narrows and narrows and narrows. And to start with, people will start snoring, and snoring is a sort of early version of sleep apnea. And then eventually the upper airway narrows enough to begin to block off. And in order to overcome that, you have to wake up. You don't have to wake up fully, but only partially, and that's why patients are not usually aware of this happening. And a few of these doesn't really matter, and I think any snorer will tend to get these from time to time across the night. When it becomes really important is when you have enough of these to badly fragment your sleep to the point where you are now sleepy during the day, but unfortunately often don't realise why, because as I say, you don't realise this is going on yourself unless somebody else points it out to you. Now, we also know quite a lot about the prevalence of this condition. There have been a lot of studies, and probably in the UK about 4 or 5% of adults have enough of this problem, enough sleep fragmentation due to heavy snoring and sleep apnea, to begin to get sleepy during the day, to the point where it begins to interfere with their functioning.
What are the most common signs and symptoms of OSA?
I think for most people it's a degree of excessive daytime sleepiness. And to start with, that sleepiness only occurs when you're really bored. So you're sitting in a meeting and it's all terribly uninteresting and you find you're struggling to stay awake. Eventually, as the problem gets worse and worse, you're finding it harder and harder to stay awake, even in quite stimulating situations like sort of driving down the road or something like that. So I think excessive daytime sleepiness and of course nighttime snoring, and a long history of snoring too, are the two key symptoms that people get with sleep apnea. And I would just like to stress it's sleepiness rather than just tiredness.
What are the consequences if OSA is left untreated?
I think many people have a degree of sleep apnea and cope. And so, for example, because they have relatively poor quality sleep, they're able to make up for that by sleeping a little later in the mornings or going to bed earlier, or perhaps sleeping a little longer at weekends. But there comes a point when you're up against the buffers and you simply can't cope. And so the consequences of leaving it untreated are ever greater excessive daytime sleepiness. Now, if you're in a vigilance critical job, then clearly you will not perform properly at your job, and that might be quite dangerous if you run a piece of equipment that is capable of causing damage. And ultimately, it's people who drive, and particularly heavy goods vehicles or public service vehicles, where the sleepiness may be the most devastating. So for me, the consequences of long-term untreated sleep apnea is probably a significant increase in quite horrendous driving accidents.
What is the recommended treatment for OSA?
Many people, unfortunately, with sleep apnea tend to be a little overweight, and we know that weight, particularly in the neck, is a risk factor for developing obstructive sleep apnea. So certainly for some people, particularly if it's quite a mild problem, losing a little bit of weight is for them a really good answer if they can do it. But we know from many arenas within medicine that trying to lose weight is very, very difficult, and in fact the right way to lose weight is to do it really quite slowly. So if you have sleep apnea, then it's going to take quite a long time to lose enough weight to get rid of the problem, and you will be symptomatic and have sleepiness all that while. So from our point of view, the really important thing to do is to get on and treat people so that you can get rid of their sleepiness as soon as possible. And we usually do that with a treatment called CPAP. The way CPAP works is really remarkably simple. By applying a very gentle air pressure to the upper airway through a little mask over perhaps just the nose or occasionally over the mouth as well, CPAP opens up the upper airway and stops that narrowing that led to snoring and stopping breathing episodes. And by gently opening the airway, the snoring goes, the obstructions go, the sleep goes back to normal, you wake up feeling refreshed and you're not sleepy anymore. And so it's a very, very dramatic treatment. You go from being badly sleep fragmented to having great sleep, and as a consequence, you're not sleepy during the day. And of course that's really, really important, because if you were sleepy driving, for example, you shouldn't be driving, and now you can. So it's a very, very dramatic treatment and a very, very simple concept.
What impact does CPAP have on a patient, their lifestyle, their health?
When patients with sleep apnea syndrome who are very sleepy start on CPAP, the change is dramatic. And I've been a chest and sleep physician for many, many years now, and therefore treat quite a lot of conditions, but of all the conditions I treat, CPAP produces the most dramatic improvement in people's quality of life. You can go from being extraordinarily sleepy, unable to do things that require you to stay awake for long periods of time, to suddenly you're back to normal. And people can't believe that they were so impeded in the way they performed at work, for example, and at home. So it really is a thoroughly dramatic treatment.
How does having sleep apnea, untreated or treated, affect your driving life?
The issue of sleep apnea and driving is really quite tricky, and it's certainly one of the hardest problems we have to deal with in the clinic and how to advise patients. And I think the first thing to be realised is that whatever the cause of sleepiness, if you are sleepy, you should not be driving. And it's just like alcohol, you just shouldn't do it. It doesn't matter what the cause is. It could be 3 all-night parties on the trot or sleep apnea, it doesn't matter. So the rules about driving, I think, are really very similar. If you're sleepy, you shouldn't be driving. Now, in the case of sleep apnea, a lot of people have sleep apnea and are not sleepy. And they don't have to stop driving because they are just normal. They just have an abnormality on a sleep study, but it's not a problem from the point of view of driving. But if people have both sleep apnea and sleepiness, what we call sleep apnea syndrome, then I think people have to be advised that they do have a condition that makes them sleepy, and they must be very, very aware and probably not drive until they are sorted out. They won't lose their licenses. As soon as possible after the diagnosis, you get treated, you don't lose your license, you're back on the road, and there isn't a problem.